Sure. Good morning, everyone, and welcome to our briefing. So we'll start off this morning with an update to the numbers. Since the last time we talked, 1,404 more Philadelphians have been diagnosed with COVID. As of yesterday, we're seeing an average of 274 new cases per day, which is slightly lower from what I reported last week. 3% of test results we're receiving are positive, which is also slightly lower than last week. This number is dropping because there's so many people getting tested, around 5,000 per day. So we're fairly confident that that positivity rate means that we're catching most of the cases in the city. In terms of vaccinations, at least 84.2% of adults have gotten at least one dose, and now 69.3% of adults are fully vaccinated. Yesterday, we reported that about 47,250 teens between 12 and 17 had received at least one dose of vaccine. And finally, about 10,800 people in Philadelphia have received a third dose of vaccine. Nearly 1,000 of those doses were administered this weekend as booster doses, but we believe this is an undercount, as many of our providers are still reporting from the weekend. We're currently working to post counts of booster doses on the dashboard and hope to be able to update you regularly on that. So speaking of booster doses, I did want to take the opportunity to talk about who needs one and how people can go about getting a booster if they're eligible. Late last week, the CDC recommended that people who are over 65, who live in a nursing home, or who are between the ages of 50 and 64 and have an underlying medical condition that puts them at higher risk, should get a booster dose 6 months after their second dose of the Pfizer vaccine. They use the word should in this recommendation because the data for a booster dose is stronger in these groups. People who are between the ages of 18 and 49 and have an underlying medical condition, and people 18 to 64 who work in jobs with a higher risk of COVID exposure, like healthcare workers, teachers, or other frontline workers, may get a booster dose 6 months after the second dose of Pfizer. They use the word may because the evidence for these groups is less strong, and there was more debate among the scientists about the need for a booster. But as we've seen here in Philadelphia, frontline workers are at higher risk of COVID, so we're glad to see that the CDC included them in their booster recommendation. It's been a while since we talked about which medical conditions put people at risk of more severe outcomes from COVID, and the list has expanded somewhat. It's too long a list to read out here, but I do want to note that overweight, meaning a BMI of 25 or higher, obesity, and being a current or a former smoker have been found to increase risk. And it's probably worth noting that if you're overweight, and please keep in mind that a BMI of 25 is only slightly overweight, or if you're a current or a former smoker and you've not yet been vaccinated, let alone had your booster, it's time to take your health seriously and get your shot. Research has shown that over time, especially in people over 65, the Pfizer vaccine may become slightly less effective against hospitalizations. You'll notice that I said less effective instead of not effective. The Pfizer vaccine is still effective, and like the other approved COVID vaccines, it's still the best way to avoid severe COVID and death. Booster doses are intended to help keep their effectiveness high for the people who are most likely to have severe COVID if they catch it. Booster doses are not just a COVID vaccine thing. In fact, most of the vaccines that our children get have boosters. They're a normal part of the vaccination process. For Pfizer, the booster dose is exactly the same as the first two doses, and side effects are very similar. Yes, you will get a sore arm and possibly a slight fever, but you've gone through 18 months of a pandemic and done much harder things. You can do this. You can get your booster at any local vaccine site that has Pfizer vaccine. Check vaccines.gov for locations that have Pfizer, and bring your vaccine card with you so they can double check the dates for you. We have not yet heard anything from the FDA or CDC about if people who got Moderna or Johnson & Johnson vaccine yet will need boosters. But if they do, we'll be ready to give them out as soon as they're approved. Finally, the companies who developed the Pfizer vaccine announced that they have submitted safety and efficacy data to the FDA on their vaccine gathered from clinical trials with children between 5 and 12. I'm very excited to hear this good news, but we've got to remember this announcement was just in a press release, and we're waiting to hear from the FDA and CDC before we do anything. I'm hopeful that this announcement means we'll be able to vaccinate our children sooner rather than later. But as we saw with the booster doses, there are many steps that still need to happen before we can start. Until that happens, there's plenty we can do to keep our children safe. Most importantly, every adult and teen around them should be vaccinated. They should wear masks when they're indoors and around others, practice good hand hygiene, and stay home if they're sick. Hopefully, it's not too much longer, and we'll let you know the latest we hear on updates of this. So to wrap up, if you'd like more information, please visit our website at phila.gov/COVID. And if you have questions, please call our COVID call center at 215-685-5488. Now I'll turn things over to Zelly to give these remarks in Spanish. Thank you.
Buenos días y bienvenidos a nuestra sesión informativa. Comencemos esta mañana con una actualización de nuestros números. Primero, desde la última vez que hablamos, 1,404 habitantes más de Filadelfia han sido diagnosticados con COVID. Hasta ayer, estamos viendo un promedio de 274 nuevos casos por día, que es inferior a lo que informé la semana pasada. El 3% de los resultados de las pruebas que estamos recibiendo son positivas, lo que también es inferior al de la semana pasada. Este número está disminuyendo porque hay muchas personas que se hacen la prueba, alrededor de 5,000 por día. Las pruebas de tantas personas y solo ver el 3% de las pruebas dan positivo significa que probablemente estamos detectando la mayoría de los casos en Filadelfia. En términos de vacunas, al menos del 84.2% de los adultos han recibido al menos una dosis y ahora el 69.3% de los adultos están completamente vacunados. Ayer informamos que alrededor de 47,250 adolescentes entre 12 y 17 años han recibido al menos una dosis. Finalmente, hasta el lunes, unas 10,800 personas en Filadelfia habían recibido una tercera dosis de la vacuna. Al menos 1,000 de esas dosis se administraron este fin de semana como dosis de refuerzo. Actualmente estamos trabajando para publicar recuentos de dosis de refuerzo en el tablero y esperamos poder actualizarlo regularmente sobre eso. Hablando de dosis de refuerzo, quiero aprovechar la oportunidad para hablar sobre quién necesita uno y cómo las personas pueden obtener un refuerzo si son elegibles. A fines de la semana pasada, la CDC recomendó que las personas mayores de 65 años vivan en un hogar de ancianos o tengan entre 50 y 64 años y tengan una afección médica subyacente que los ponga en mayor riesgo, deben recibir una dosis de refuerzo 6 meses después de su segunda dosis de la vacuna Pfizer. Usamos la palabra debería en esta recomendación porque los datos para una dosis de refuerzo son más fuertes en estos grupos. Las personas que tienen entre 18 y 49 años y tienen una afección médica subyacente y las personas de 18 a 64 años que trabajan en trabajos con un mayor riesgo de exposición a COVID como trabajadores de salud, maestros u otros trabajadores de primera línea pueden recibir una dosis de refuerzo 6 meses después de su segunda dosis de Pfizer. Usamos la palabra puede porque la evidencia para esos grupos es menos fuerte y hubo más debate entre los científicos sobre la necesidad de un refuerzo. Pero, como hemos visto aquí en Filadelfia, los trabajadores de primera línea tienen un mayor riesgo de COVID, por lo que nos complace ver que la CDC los incluyeron en su recomendación de refuerzo. Ha pasado un tiempo desde que hablamos sobre qué afecciones médicas ponen a las personas en riesgo de resultados más graves de COVID y la lista se ha ampliado un poco. Es una lista demasiado larga para leerla aquí, pero quiero señalar que el sobrepeso, un índice de masa corporal de 25 o más, la obesidad y ser un fumador actual o anterior han demostrado aumentar el riesgo. Y probablemente valga la pena señalar que si tiene sobrepeso y tenga en cuenta que un índice de masa corporal de 25 tiene solo un poco de sobrepeso, o si es un fumador actual o anterior y aún no se ha vacunado y mucho menos ha tenido su refuerzo, es hora de tomar en serio su salud y vacunarse. La investigación ha demostrado que con el tiempo, especialmente en personas mayores de 65 años, la vacuna de Pfizer puede llegar a ser ligeramente menos efectiva contra las hospitalizaciones. Notarás que dijimos menos efectivo en lugar de no efectivo. La vacuna de Pfizer sigue siendo efectiva y, al igual que las otras vacunas de COVID aprobadas, sigue siendo la mejor manera de evitar el COVID grave y la muerte. Las dosis de refuerzo están destinadas y ayudar a mantener en efectividad alta para las personas que tienen más probabilidades de tener COVID grave si lo contraen. Las dosis de refuerzo no son solo una cosa de la vacuna COVID. De hecho, la mayoría de las vacunas que reciben nuestros niños tienen refuerzos. Son una parte normal del proceso de vacunación. Para Pfizer, la dosis de refuerzo es exactamente la misma que las primeras dosis y los efectos secundarios son muy similares. Sí tendrá dolor en el brazo y posiblemente fiebre leve, pero has superado 18 meses de pandemia y has hecho cosas mucho más difíciles. Puedes hacer esto. Puede obtener su refuerzo en cualquier sitio local de vacunación que tenga la vacuna Pfizer. Verifique en vaccines.gov para conocer las ubicaciones y traiga su tarjeta de vacuna con usted para que puedan verificar las fechas por usted. Todavía no hemos escuchado nada de la FDA o la CDC sobre si las personas que recibieron la vacuna de Moderna o Johnson & Johnson necesitarán refuerzos, pero si lo hacen, estaremos listos para entregarlos tan prontos como sean aprobados. Finalmente, las compañías que desarrollaron la vacuna de Pfizer anunciaron que han presentado datos de seguridad y eficacia a la FDA sobre la vacuna recopilados de ensayos clínicos con niños de entre 5 y 12 años. Estoy muy emocionada de escuchar esta buena noticia, pero tenemos que recordar, este anuncio fue solo en un comunicado de prensa y estamos esperando escuchar a la FDA y a la CDC antes de hacer algo. Tengo la esperanza de que esto anuncio signifique que podremos vacunar a nuestros hijos más temprano que tarde, pero como vimos con las dosis de refuerzo, hay muchos pasos que aún deben suceder antes de que podamos comenzar. Hasta que eso suceda, hay mucho que podemos hacer para ayudar a mantener a nuestros hijos seguros. Lo más importante, todos los adultos y adolescentes a su alrededor deben vacunarse. Deben usar máscaras cuando están en interiores y alrededor de otros, practicar una buena higiene de manos y quedarse en casa si están enfermos. Esperamos que no sea mucho más largo y le informaremos lo último a medida que escuchemos las actualizaciones. Para concluir, si desea obtener más información, visite nuestro sitio de web en phila.gov/COVID. Si tiene preguntas, llame a nuestro centro de llamadas COVID al 685-5488. Gracias. Thank you.
Thank you very much, Zelly. With that, we'll now move to Q&A. Again, reporters are asked to limit their questions to 2 or fewer and ask that you stick with the topic at hand. If there are any reporters who do not get the chance to ask a question, please follow up by email. It looks like we have a question here from Zimina Conde from WHYY. You should be able to unmute now. Go ahead.
Yeah, so I know you said, so the CDC said 18 to 64-year-olds who don't have underlying conditions but are at an increased risk of exposure may get the booster. Is the city doing anything to sort of do any outreach to these people? Are you encouraging them to get vaccinated?
Yeah, so we began offering boosters as soon as they were approved. But we are focusing our outreach on our least vaccinated neighborhoods because those are the groups that we're afraid will be least likely to get boosters in the same way that they were least likely to get vaccinated initially. So we'll be looking at primarily our lower income zip codes, which correspond with the lowest vax neighborhoods. The simplest way for us to start that outreach is through text messaging to people who are more than 6 months out based on the data we have in our vaccine records. They'll of course need to be much more than that, but that's a place we can start. I will say we're not going to send text messages to all of those people at the same time just to avoid creating a run for vaccine, but things have been very smooth so far.
Thank you.
Thank you very much. Next up, we'll go to Annie McCormick from Channel 6. Go ahead, Annie.
Hello. Quick question for you in regards to, we're starting to hear about more employers, specifically healthcare systems, airlines, that are now letting go the employees that did not meet the vaccine mandate by deadlines, albeit compared to the amount of employees that they have, there's small amounts. For example, the airline United has up to 600 people that they're letting go. That's versus thousands of employees that they have. But my question for you is, I'm wondering, and maybe this is better for the mayor, but I'm wondering if within the city, if you're already seeing a large impact of a number of people that haven't been vaccinated, or if you're getting calls from local employers asking how to handle it, and if there's been a big impact on those businesses from people that choose not to get vaccinated.
So we haven't heard of people being let go in large numbers in the city of Philadelphia. The place where questions are coming up right now is around our healthcare worker mandate, which kicks in on October 15th. And we are trying to work with healthcare institutions that have questions to help support their efforts to get all of their workers vaccinated. And also to answer any questions they have about the exemption process for people who are requesting medical or religious exemptions.
And a follow-up question for you too, in regards to the city employees that do have those exemptions, that instead are wearing masks and then also getting the weekly testing, how is the weekly testing being done? Can you give us an example? Like, do they report to the health department to get tested? Is it something that's done within their department? I'm just trying to get a better idea of how it happens.
So it sounds like you may be conflating 2 different mandates. There is a city worker vaccine requirement that requires people to either be fully vaccinated, or if they're not fully vaccinated, they are required to double mask. City workers are not required to be tested unless they're symptomatic or exposed, just like anyone else. And we did that in part to avoid a situation where there would be lots of people who would need testing at a time we were worried about a surge. But so city workers don't have a testing mandate, so there's not, that piece doesn't exist. The healthcare worker mandate is the place where the testing comes in. People who have exemptions to the healthcare worker mandate, which again kicks in mid-October, they would be required to get tested.
Okay, that's all I have. Thank you.
Thanks so much, Annie. Next up, we're going to go to Pat Loeb from KYW. Go ahead, Pat.
I just wanted to get an update on the mask mandate and whether you are projecting how long that may last.
That's a great question. So I think we've seen really fantastic results here in Philadelphia with our mask mandate. If you look at the date of the mask mandate and you look at what happened to the graph about 10 days later, it's impressive. So we like that mask mandate. It isn't costing people their jobs. It's, not costing people their livelihood. We are likely to keep that until this pandemic is really well under control because it's working well. And I just say thank you to all the Philadelphians who have put their masks on and kept them on.
Thanks.
Right. Thank you very much, Pat. Next up, we'll go to Rudy Chinchilla from Channel 10. Go ahead, Rudy.
Thank you. Hey, good morning. My question is also regarding masks. And I guess the first question would be, you just mentioned that we're going to keep masks until the pandemic is well under control. There is no timeline on that, right? It could be well into next year or even later, right?
So, I feel like we all kind of control that timeline in terms of our actions. We at this point have a fairly good idea of what it's going to take to bring it under control, although it would help if the rest of the country came with us on this. But the more people who get vaccinated, the quicker this will get under control.
Right. And then my follow-up to that was Pennsylvania's Senate, Republicans are advancing a bill trying to give parents and guardians the authority to overturn local mask mandates at school. It's probably going to die. It's probably going to get vetoed by Governor Tom Wolf. But nonetheless, I mean, what do you think about the fact that we're still having this debate regarding masks in schools?
I mean, I think you can probably guess my answer to that. I'm a physician and a public health professional. I do actually believe in science. I think you probably also believe in science. Masks work. We have many, many, many studies at this point to show us that they work. They aren't perfect, and they are annoying, and we need to work to wear them. And we need our kids, especially in school, to wear them because that's the defense that they have, right? They don't have the ability to get vaccinated yet if they're under 12. And for a lot of the kids over 12, they may have many classmates in their classroom who have not yet been vaccinated. So those masks are the difference between a fall surge and not having a fall surge.
Thank you. Appreciate your time.
Thank you very much, Rudy. Next up, we're going to go to Laura McChrystal from the Inquirer. Go ahead, Laura.
Hi. A few more questions on the vaccine mandate for healthcare and higher education workers. You said you're getting questions about, employers dealing with exemptions. Is the city actually reviewing exemption requests, or is that left up to employers?
That is left up to employers. They're expected to have a system for doing it, but we don't review the exemption requests.
Okay. And, once we get to that October 15th date, will there be, any kind of enforcement or checking that the city will do with all of those employers?
Yeah, so after the mandate kicks in on October 15th, we have the ability to request, the records of who's been vaccinated to make sure that they're tracking adequately. We will enforce, we do believe that this is very important. We're likely to enforce first in the most high-risk settings. So, you can anticipate our attention is going to be drawn to the long-term care facilities first, because that's where we've seen the most deaths. But yeah, the expectation is that we'll enforce, but that most healthcare institutions really are taking this seriously. The questions we're getting are serious questions, not people who intend to ignore it. And, I think what we've seen, if you're following what happened at Penn and what's happening in New York, is that people actually do step up and get vaccinated with these mandates. And of course, the federal mandate will kick in, I think, sometime in October as well.
Okay, and one last quick question. Have you heard concerns from any of these healthcare employers that they might have staffing shortages as a result of the mandate?
Yeah, no, I think everyone is concerned. And again, I think we are at least somewhat reassured by what we're seeing happening in New York, where people are stepping up and getting their vaccines, even if they really didn't want to. But most people do, when faced with a mandate, they do get vaccinated. This is a tricky time because there are staffing shortages in healthcare at baseline, right? Because people are really, really tired of COVID. I know everyone is tired of COVID, but the people who have been dealing with the the healthcare consequences, I think maybe are more tired. And so they have shortages going in. You know, on the other hand, unvaccinated employees tend to lead to more staffing shortages, right? Because if you have somebody who is bringing COVID into the workplace, exposing other people, you're going to be short a lot of staff as people are out isolating and out quarantining. And ultimately, it's the risk to patient safety that we have to think about here. You know, as I mentioned, there were more than 1,000 deaths in nursing homes alone from COVID. And, you know, people in nursing home beds aren't going out and bringing COVID in. That's coming from staff. And when we didn't have a vaccine, that was one thing. But now that we have a vaccine and the ability to protect people, we really need to do that.
Okay, thank you.
Thank you very much, Laura. Seeing no other hands raised, we're going to wrap things up. That will conclude today's press briefing. And as usual, we will announce next week's briefing via Twitter and media advisory when a time and date are set. We look forward to seeing you all then. Thank you very much.